Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. We all are scared of gynecological cancer staging. So here I have tried to summarize ovarian carcinoma, endometrial carcinoma and cervix in one video. Okay, so let's see. So whenever it comes to staging, we have to keep in mind that stage 1 will be limited to the organ itself, whereas stage 4 will be metastasis. Okay, we'll see each cancer one by one. First, let's talk about ovarian neoplasm. Okay, stage 1, I have told you it will be limited to ovary only. Okay, so we have 1A, only one ovary is involved. 1B, both ovaries are involved. Here you have to keep in mind that capsule is intact. Then we have 1C, here capsule is ruptured, and in capsule is ruptured we have 3 points. 1C1 intraoperative rupture, 1C2 preoperative rupture, 1C3 malignant ascites. So this was about the stage 1 of ovarian neoplasm, that is limited to the ovary. In stage 2 it spreads to other pelvic organs. Okay, so which organ is nearest to ovary? Fallopian tube and uterus. So in 2A the spread is to fallopian tube and uterus. In 2B, bladder and rectum. You have to keep in mind in stage 2B of ovarian carcinoma it spreads to bladder and rectum. Coming to stage 3 of ovarian carcinoma, now it spreads beyond pelvis into the abdomen. In stage 2 it was spreading into the pelvis only. Okay, in stage 2 it was spreading to other pelvic organs only, but now in stage 3 it is spreading beyond the pelvis into the abdomen. So here in stage 3, in all the stages of stage 3 we have three things: A, B and C. In 3A, 3B and 3C we'll see 3A has 3A1 and 3A2. 3A1 is only retroperitoneal lymph node is involved. Stage 3A2, microscopic involvement above the pelvic brim. Okay, so it is just going above the pelvis but microscopically. Coming to 3B, now here is macroscopic involvement above the pelvic brim, but the size of implant is less than 2 cm. And if the size of implant is more than 2 cm, we'll call it as stage 3C. We have to keep in mind in 3B and 3C there can be involvement of liver and spleen capsule and surface. So this was stage 3 of ovarian carcinoma. In stage 4 we have distant metastasis. So stage 4A we have malignant pleural effusion. We have to keep in mind that the metastasis from ovary will go to the lungs. Lungs only. And stage 4B we have liver or spleen parenchyma is involved or inguinal lymph node involved. So this was the staging of ovarian carcinoma. Now we'll look for endometrial carcinoma. In stage 1 we have very simple thing. I have told you it is limited to the uterus. 1A, less than 50% of myometrium is involved. 1B, more than 50% if myometrium is involved, but it is limited to uterus. In stage 2 there is involvement of cervical stroma and glands. Simple. Coming to stage 3 of endometrial carcinoma, we have three things. As I have told you, in all the third stage of all type of carcinoma we have three things: A, B, C. So 3A, serosa and adnexa is involved. Adnexa is fallopian tube and ovary. In 3B, vagina and parametrium is involved. Okay, so now it is crossing beyond cervix. Okay, stage 3 is beyond cervix, whereas stage 2 was the stroma and glands of the cervix only. So 3B was vagina and parametrium involved. Stage 3C, lymph node is involved. In 3C we have pelvic lymph node and para-aortic lymph node. C1 is pelvic lymph node and para-aortic lymph node. You can see here only that in CS cervix same thing is applied in the third stage. Okay, pelvic lymph node, para-aortic lymph node. We'll see there later. In fourth stage of endometrial carcinoma we have 4A and 4B. 4A, regional metastasis to bladder and bowel. Okay, in fourth stage of endometrial cancer there is metastasis to bladder and bowel. In 4B there is distant metastasis or superficial lymph node is involved. You have to keep in mind here bladder and bowel involved in fourth stage, whereas in ovarian carcinoma it was involved in second stage only. Okay, so this was about the endometrial carcinoma. Coming to the third one, we have CA cervix? It is very easy. Here we have again 1A, 1B. 1A is microinvasive, that is less than 5 mm depth is involved, and macroinvasive is more than 5 mm. Okay, so we'll see. 1A1 means less than 5 mm, we have less than 3 mm, and 1A2 4 to 5 mm. Macroinvasive less than 2 centimeter, less than 4 centimeter, and B3 that is more than 4 centimeter. Okay, so this 4 centimeter is very important if we'll see the treatment part. Okay, so 1A, 1B, 1A is microinvasive, 1B is macroinvasive. 1A was again divided into 1A1 and 1A2. 1B was again divided into 1B1, B2 and B3. Okay, so just remember the size 2, 4 and more than 4. Here less than 3 mm and 4 to 5 mm. Coming to stage 2 of CA cervix, here the involvement of upper 2/3 of vagina. Okay, suppose this was cervix, above this is vagina, so upper 2/3 of vagina is involved. In stage 2, C2, so we have A and B. Stage 2A, 2B. In 2A, parametrium is not involved, and 2B, parametrium is involved. Again, when the parametrium is involved in 2A, it was divided into 2A1 and 2A2. 2A1 less than 4 cm, 2A2 more than 4 cm. Simple. Third stage of CA cervix. Here the involvement of lower 1/3 of vagina. Very important. Lower 1/3 of vagina. Again, third stage. So it will be A, B, and C. Third A, we have pelvic side wall not involved. 3B, pelvic side wall is involved. When pelvic side wall is involved, it can involve ureter, kidney also. So it may cause hydroureter, hydronephrosis. Okay, in 3C, same as endometrial carcinoma, we have lymph node involvement. In 3C1, pelvic lymph node involved. In 3C2, para-aortic lymph node is involved. Coming to fourth stage of CA cervix, that is metastasis. 4A, 4B. A is regional metastasis, that is bladder and bowel, and 4B, distant metastasis or superficial inguinal lymph node is involved. So this was about the staging of CA cervix. So here I tried to summarize all the stagings of ovarian, endometrial and CA cervix in one video. Okay, we have to keep in mind stage 1 limited to the organ, stage 3 we have 3 subparts A, B, C, and stage 4 distant metastasis. You just write it twice and thrice, you'll remember it. Okay, thank you so much.